Good morning, and welcome to your daily Farm and Home Show, brought to you by the University of Kentucky Cooperative Extension Service. And now, here's your host. Good morning, and welcome to your Farm and Home Show. My name is Joanna Coles, and this morning we're visiting with Rhonda Linden, and she's with Rivendell. Good morning, Rhonda.
Good morning.
Well, I'm glad you're here today because it's not the most comfortable topic that we're going to talk about today, but it's something that we need to talk about because it is here. It is in our world, and we probably know somebody who might be suffering, and we need to look for some of those signs, and that's depression.
That is depression, and when we think about having healthy families and building healthy families, you know, being attuned to mental health issues in our families is so important. Depression is one of the most treatable of our mental health issues, and so being able to recognize it and get a handle on it, you know, can change the life of an individual, their family, and everyone around them.
Mm-hmm. And so a lot of times we might miss some of those warning signs. Could you talk a little bit about maybe what to look for in families?
Yes. And this is something we can look for in ourselves too. Depression actually hurts. It hurts your head. It just, the fatigue and the tension and the stress of it is hurtful. So we can look for people who don't feel well, who aren't feeling well. Sadness, a feeling of sadness and hopelessness and despair that goes on. And we kind of look at these symptoms for having them every day for 2 weeks, for about 2 weeks. At the end of 2 weeks, if you've not had a good talk with a buddy or a hug from your mom or whatever, and things aren't looking up, you know, at the end of 2 weeks, then you're thinking, you know what, maybe something is going on here. Agitation, irritability, tearfulness, sleep disturbance, maybe waking up too early, you know, waking up at 3 o'clock or 2 o'clock every morning instead of your normal time, or sleeping all the time, changes in behaviors. The longer that somebody experiences depression, again, the chemical response in their brain changes. And sometimes after a couple of weeks, it's not quite as easy as saying, get over it, snap out of it.
Get happy.
You know, get happy. Why do you always see the downside of everything? You know, it doesn't really, that's not really very helpful. What's more helpful is to say, are you suffering? What's going on? And when you'll see when someone's confiding in you that they'll kind of have a circular pattern, you know, to their problems, and they just can't quite see their way out, and they just can't quite see a way to get better. And that's the time I first like to go to my physician and say, am I okay? You know, is there something wrong with me? Am I sick? And then to a mental health professional to do some psychotherapy, some talking therapy about, you know, I can't see my way out of these problems. And another perspective, somebody checking to see that my thinking makes sense, you know, those things might give me a whole new perspective on things. And if they don't, we have some good medicines. I think we have 22 antidepressants that are available to help restore kind of that chemical balance to a brain.
And you know, you mentioned, we talked earlier in the week about substance abuse and suicide, and you mentioned that depression was one of the most treatable. And a lot of times, if it's not treated though, it turns into something much more.
Yes, you know, a common element to suicide and to substance abuse is depression. Depression can certainly exist completely on its own, but we see it in these other behavioral disturbances. We see it in somebody making attempts against their life because they're hopeless, they're overwhelmed, they see no way out. The same thing with substance abuse. You know, it may be that I finally found something that made me feel a little bit better, and now you want me to stop. So there may be some self-medicating sometimes that we see with substance abuse.
Now, does Rivendell have any services for people who might be depressed? Or?
We have great services for children and for adolescents with depression.
Okay.
We have great services for adults with depression who also have substance abuse disorders. And we have an outpatient psychiatry clinic that can help with some of those persistent and lingering depressions that we might want to treat with medication.
Okay, so if people are at home and they think, you know, I might need one of those services, would you just recommend to call, to give you guys a call and just maybe talk through it?
Just call, talk through it on the phone. We can give you some advice and some direction there. We may invite you in to come in for an assessment we may refer you right at that point to an emergency room physician or something like that, but we will help you figure it out. We frequently get calls from families who are worried about one of their family members. Call us, we'll help.
All right, well, Rhonda, certainly appreciate the information and being here with us this week. And if you have questions, make sure to give Rivendell a call. Thanks for watching and have a great day. If you have questions about today's topic, please call the Warren County Extension Office at the number on your screen. Thanks for watching and have a great day.